Hello. Hi. Welcome in. You're here for, let me see, ADHD test, right? Yeah. I have you written in here. Could you just tell me your name for confirmation? Okay, yeah, that's right. Good. Alright. If you just give me one moment, let me pull out your paperwork here and I'll just sit down and have a chat, okay? One moment. Okay. And let me get my questionnaires here, because I'll be asking you a lot of questions today. Hope you don't mind. Okay. Yeah, looks like we have everything. So, first of all, I'm wondering, what brings you in to get an ADHD test today? For example, were you recommended by like a family member or teacher perhaps, or was it just your own choice? Okay. And have you been tested before? Okay. No. Was it from childhood or adolescence or more into adulthood when you started noticing these signs that you may think you may have ADHD, or when people told you in your life that you may? Okay. Yeah, it all depends on the person. Some people, it tends to start showing signs in childhood, and some people maybe all the way into adulthood. So, yeah, there's no right or wrong time. Okay. And I forgot to ask, for your date of birth, I just need to know how old you are. Okay, good. Thank you. Where was I? Oh, have you been diagnosed with anything before in the past, whether it be ADHD or something else? Yeah, it could be anything, from anxiety to depression to diabetes, anything like that. Okay. And when did you receive that diagnosis? Okay, I got you. Alright. And I want to ask a bit about your family history. So with regards to ADHD, do you know if anyone in your family has ADHD? Okay. So, okay, so on your mother's side, so never on your father's side that you're aware of? It's really hard to say, right? Because a lot of people go through life undiagnosed. But you can say for sure that there's been some on your mother's side. Okay. And then what about other things aside from ADHD? Any family history? Like I said, things like anxiety, depression, or heart disease, diabetes. Okay. I see. Okay. And are you currently taking any medication? Okay. Okay. And then have you taken any other medications in the past? May I ask what that was for? Okay. And do you have any allergies that you're aware of? Yeah, okay. I am also lactose intolerant. Okay. Do you have any problems with your vision or hearing? Okay. So, how often do you wear your glasses? Is it just sometimes, or is it like, I see you're not wearing your glasses right now, so. Okay, so more for like driving or when you need to see a far distance. Okay. And when was the last time you had a vision exam? Okay, yeah, I recommend getting that checked out again soon, just to be sure. Okay, and what about your hearing? Sorry, did you say? Okay, so you think your hearing's alright? I think we should get you signed up for a hearing test, just in case. I like to have a good understanding of the hearing and vision and sort of sensory input for patients testing for ADHD. Okay, yeah, let me just make a reminder of that. And we can set you up with an appointment at reception on the way out, okay? Great. Okay. So, let me see. That should be about it for my introductory questions. Now before we get into the actual testing for ADHD, is there anything you would like to tell me first? Could be anything that you think might be important information about you. Okay. Thank you. Or are you comfortable now? Do you need anything, water or? Okay. Yeah, just let me know if there's any problems or if you need a break. Anything like that. No worries, no pressure. We have lots and lots of time today. No rush. Nothing like that. Okay. So, yes, before we get into our examination, let me just tell you a bit about how we diagnose for ADHD and the sort of things that we'll be looking for. So I don't know how familiar you are with ADHD, but it can be broken down into 3 really general categories. There's hyperactive, inattentive, and then combined. Some people are able to really clearly distinguish what category they fall into. Some people, it's not so black and white. It really all depends on the person. And the categories really aren't so important, but they can be helpful for some people to understand what's going on with them better. So, would you like to hear more about those categories? Okay, yeah, let me see here. I wrote my list. So, what I was saying, hyperactive. There's a group of symptoms or traits that would show more for the hyperactive type, and that is impulsive or fidgety, can't hold still, restlessness, feeling like you always need to be moving. You have a trouble waiting in line or waiting for your turn, maybe an issue with patience, someone who speaks out or maybe has a tendency to interrupt people in conversations, or people who you may have been told that you speak a lot or kind of ramble on about things. And oftentimes the hyperactive type seems to be more common with males than females, but of course there is no certain rule for that. Okay, And a lot of the time, people who fall under the hyperactive category receive their ADHD diagnosis earlier in life. So these sort of traits you may think of when you think of a child who has ADHD, who can't sit still, who maybe acts out or speaks out in class, things like that. It's more characteristic of the hyperactive category. Okay, but that is not all there is to ADHD. So there's another set of traits that fall under the inattentive category. I would say people are slightly less familiar with the inattentive category, and people who only fall under inattentive oftentimes can go through life undiagnosed, because I like to say that hyperactive, you can see a lot of the traits externally, can be viewed by teachers, friends, parents, whereas the inattentive traits that I'm about to tell you oftentimes are present internally. So maybe you feel it yourself, but because other people don't notice it and don't give you that feedback about it, it can really go unnoticed by others and go undiagnosed. So that inattentive category, sorry, I need to tell you the traits. So getting easily distracted, or forgetful, forgetting things, forgetting tasks, losing track of time, overlooking the details of something, or going way too into the details too much, becoming kind of hyper-focused, hyper-fixated on certain things or certain details. If you lose things frequently, you have difficulty focusing on things that are not interesting to you, and similarly difficulty listening to things that aren't so important to you at that time. And opposite of hyperactive, oftentimes females have a correlation with the inattentive traits. But again, no matter what gender you are, of course you can fall under either of these two categories. That's just according to data that has been collected over the years. Okay, so I've told you about hyperactive and inattentive, and then there's also the combined category, and as it sounds, that's where people have a combination of both categories. And when people have this combined hyperactive and attentive ADHD, there's a few traits that they often also have, which includes sleep issues. It could be trouble falling asleep or often waking up in the middle of the night, and also sensory processing troubles, difficulties, and that could be visual information, that could be auditory information. And because of that, that's why we also like to test the vision and hearing, as I discussed earlier, just to rule out any issues with vision and hearing that could be mimicking these sensory processing problems seen in ADHD. Okay. I know that was a whole lot of information. Do you have any questions, or I could repeat anything if you need me to? Okay. Yeah. So I do want to say I do speak from personal experience with some of these things. So if you have any questions that you feel like you don't want to be judged or a bit ashamed, don't have any worries at all, because I can relate to some extent, and there's absolutely no judgment here. Okay. Please don't feel afraid to open up about some things you may be experiencing. Okay. Right. So we discussed the categories. And just right off the bat, before I go into the specific tests and the questionnaires, I was wondering if you personally feel like you identify with either of the three categories that I mentioned. Okay, so you have felt some traits in both categories before. Alright, yeah. So it can really help us narrow that down once we go through our tests here. So let me pull up the questionnaires that we have prepared. Now there's a few, and depending on your results, there may be more tests that I would like to do following. So we'll just go through the process here. Okay. Now I will be reading the questions to you, and I just want you to listen to the questions, take a moment to think, and no rush, no pressure. Just let me know your answer whenever you have it, okay? And I'll be taking some notes throughout the process, okay? Alright, let's get started here. So I will be asking you a question, and then I will give you some multiple choice answers that you can choose from. Okay, and you let me know which one you identify with the most, okay? So first, when do you first remember having problems focusing, paying attention, or sitting still? When do you first remember having problems focusing, paying attention, or sitting still? For as long as I can remember, in recent years, less than 1 year, only in the last few months, or not sure. 5 options there. Okay. Cute. Okay. How often do you experience symptoms of ADHD? And those symptoms include traits that I previously listed under the hyperactive and attentive or combined categories. How often do you experience any of those symptoms? All the time, often, sometimes, or never? All the time, often, sometimes, or never? Okay. How do you feel about the following statement? When something goes wrong, I tend to think of the worst possible scenario. When something goes wrong, I tend to think of the worst possible scenario. You can strongly agree, somewhat agree, disagree, or strongly disagree. Okay, thank you. Do you agree with the following statement? I become overwhelmed when I have a lot of organizational tasks. I become overwhelmed when I have a lot of organizational tasks. Again, strongly disagree, somewhat agree, disagree, strongly disagree. Okay. How often are you distracted by activity or noise around you? How often are you distracted by activity or noise around you? All the time, often, sometimes, rarely, or never. So that was all the time, often, sometimes, rarely, or never. Distracted by activity or noise around you. Okay. Now, do you agree with the following statement? It is difficult for me to pay attention and stay focused during difficult or tedious work. It is difficult for me to pay attention and stay focused during difficult or tedious work. Strongly disagree, somewhat agree, strongly agree, somewhat agree, disagree, or strongly disagree. How often do you struggle with sitting still in one place? How often do you struggle with sitting still in one place? All the time, often, sometimes, rarely, or never. How often do you find yourself interrupting others in social situations? How often do you find yourself interrupting others in social situations? All the time, quite often. It happens, but rarely, or never. All the time, quite often, rarely happens, or never. Okay. Do you often leave things to the last minute? Do you often leave things to the last minute? Always? Too often for your liking? Occasionally? Rarely? Or never? Always? Too often for your liking? Occasionally? Rarely? Or never? Okay. How do you feel about the following statement? Even when I have time for myself, I find relaxing difficult. Even when I have time for myself, I find relaxing difficult. So, do you feel that way all the time, often, sometimes, or are you pretty relaxed? All the time, quite often, sometimes feel that way, or you're pretty relaxed. Okay. Alright. And then, when you think of those ADHD symptoms that we discussed earlier, where do you struggle with those symptoms the most? And now you can select multiple of these answer choices. So, do you experience these symptoms at work, at school, or while studying? In relationships, it could be friends, family, or romantic relationships. During social outings like parties or dinners or hanging out with friends? Or is it a part of your everyday life? You can select any of the options. More than one is fine. Okay. And now, when you think about your mental health, have you ever struggled with any of the following? And you can select multiple here. Depression, obsessive compulsive disorder, anxiety, learning difficulties, or other. And for other, you can mention anything. Okay. Alright, got it. Now the final question of this final question of this introductory questionnaire is to check off any of the following symptoms that you relate to. So you can pick any here. So I'm going to read a symptom and I want you to give me 1, 2, or 3. 0, 1, 2, or 3. So 0, you don't experience this at all. 1, a little bit. 2, a moderate amount, or 3, a lot. So 0, 1, 2, 3, okay? First, lack of motivation. Lack of motivation. 0, 1, 2, or 3. Okay. Low self-esteem. Low self-esteem. Okay. Racing thoughts. Racing thoughts. Alright. Difficulty focusing. Difficulty focusing. Struggling to complete tasks. Struggling to complete tasks. Chronically late. Chronically late. Fidgeting, restless, or irritable movement. Forgetting commitments frequently. frequent mood swings? Okay. Now that is everything on the list here. Okay, so that data is being logged into this system. In the meantime, I'm gonna ask you how you are feeling. I know that was a lot, and it can be really tiring to have to talk about all these things and think so hard about yourself and your behavior in your past. So yeah, sorry, but you're doing really well, and we are more than halfway done. So how do you feel? Okay, very good. So we can just take a moment to relax, just breathe, and enjoy not having to think about anything here for a moment while the data is loading. Just breathe in and out. No worries, no worries. You did really well with answering everything. Okay, so it looks like we are ready to start the next exam whenever you're ready. Absolutely no rush. If you need to take a moment, have a sip of water. Okay. So, for these questions, there's some more specific ways that you need to answer. So I'm going to ask how frequently you experience something, and you can answer in one of 5 ways. You can answer never, rarely, sometimes, often, or very often. So give me one of 5 ways to describe how frequently you experience a certain event, trait, behavior, feeling, etc. Okay? And now, when you are thinking of those behaviors, we're only talking about within the past 6 months. Only in the last 6 months. So not your childhood, not 2 years ago, only the last 6 months, okay? So this is just your recent behaviors and feelings, okay? Alright, so let's get started. And just so you know, there are 18 questions on this one. Just so you know what we will be doing. 18 questions, okay? If at any point you need a break, you can let me know. Alright, so starting. How often do you have trouble wrapping up the final details of a project once the challenging parts have been done? So having trouble wrapping up the final details after you've done the hard parts. Never, rarely, sometimes, often, or very often. Okay. Number 2. How often do you have difficulty getting things in order when you have to do a task that requires organization? Okay. How often do you have problems remembering appointments or obligations? And this is only in the past 6 months, okay? Remember that. Okay. When you have a task that requires a lot of thought, how often do you avoid or delay getting started? Okay. How often do you fidget or squirm with your hands or feet when you have to sit down for a long time? Okay. How often do you feel overly active and compelled to do things like you were driven by a motor? Okay. often do you make careless mistakes when you have to work on a boring or difficult project? How often do you have difficulty keeping your attention when you're doing boring or repetitive work? How often do you have difficulty concentrating on what people say to you, even when they are speaking to you directly? Okay. How often do you misplace or have difficulty finding things at home or work? Okay, got it. How often are you distracted by activity or noise around you? Okay. How often do you leave your seat in a meeting or in other situations in which you are expected to remain seated? Okay. Got it. How often do you feel restless or fidgety? Restless or fidgety. Okay. How often do you have difficulty unwinding and relaxing when you have time to yourself? Okay. How often do you find yourself talking too much when you're in social situations? Talking too much. Okay. And number 16 now. When you're in a conversation, how often do you find yourself finishing the sentences of the people you're talking to before they can finish the sentences themselves? Okay. How often do you have difficulty waiting your turn in situations when turn taking is required? Difficulty taking turns. Okay. Got it. And finally, number 18. How often do you interrupt others when they are busy? How often do you interrupt others when they are busy? Okay. Alright. And now there's questions here more about just generally about you as a human being. And I already have some of this information. Let me just go through and fill it out real quick. Yeah, so we already have your age, you mentioned earlier, gender, okay, ethnicity, household, income, those things are not required. Place of birth, etc., etc., etc. Okay, so which of the following identities describes you? You can select any or all that apply. So, veteran or active duty military, caregiver of someone living with emotional or physical illness, LGBTQ, student, trauma survivor, new or expecting parent, or healthcare worker. Yeah, it's important to know if you belong to any of these groups because your environment can greatly impact your behaviors. Okay, it's important to take that into consideration. Okay. And then it's asking about mental health, which we talked about earlier. Okay. Following healthcare, okay. And here's a more detailed list about other health conditions, but I just want to check off, cross out any possibilities here. So, mentioned earlier heart disease. What about reproductive health concerns such as PCOS, endometriosis, infertility, or anything like that? Okay. And diabetes. Any type of cancer. Okay. Arthritis or any other form of chronic pain. Okay. COPD or any other lung conditions. Alright. And any movement disorders such as involuntary tics or... Okay. Right, and then other, so any other things that were not just mentioned that you may have just remembered. No, that's okay. Okay, great. So, now the results are loading. So we won't have your final diagnosis available immediately. We have to go through all your data and your answers and stuff, and then I'll have to reflect on the interview today and everything, and your behavior during your interview today as well, and then consult with the diagnostics for ADHD and consult with the other doctors, and then we can come to a conclusion, and then be in touch with you very soon within the next few days, and then meet up to discuss a treatment plan. Excuse me, I need a drink of water. So, but based off your answers to a lot of the questions today, personally, from my experience, I have a feeling that you may be on the spectrum for ADHD. But we'll be able to tell you more about that in detail once your full diagnosis report is completed. Yeah, let me see if I am missing anything here. Do you have any questions for me? Any concerns? Okay. Well, it has been a pleasure speaking with you today, and I hope you had a somewhat positive experience. And I'll see you soon, okay? When we can go over your report of your diagnosis. Okay. Have a nice day. Thank you for coming in. Bye-bye.